We do have a lot of questions. We want to give the audience a chance to join us. I'm also going to start another poll about AI. We want to know what you guys think about three quick things. Mainly if you've seen any success stories yourself, personally, that is. And while the polls run, I'm going to ask a couple of questions that came in. We have one very interesting one, but I know it's going to be big. And Matthew, I know you might have to drop early, so I want to make sure I direct that question to you first. Matthew, my question is from our friend Mariam Shukrallah, who's from the WHO in Geneva. And she's asking about how can we guarantee that digitalization of healthcare is not contributing to further fragmentation or creating a parallel system, especially when governments are lagging behind in mindset and startups are avoiding governments for reasons that we know?
Well, you can't guarantee it. I mean, there are things going on. I mean, Ali mentioned him having a PhD in physics. If you had told me when I was a kid that the richest country in the world now had a major political party that just flat out does not believe in science, I would, or that there are people who are, opposed to vaccination or what have you. There's a lot of stuff that you can't predict. And having said that, the opportunity for using technology to fix equity in healthcare is much greater than not using it, right? Because in the end, if you have only, you're going to have expensive professionals who need a lot of care and need to be concentrated in, are going to be concentrated in places they live, which are going to be nice suburbs and big urban areas. You are not going to have as many professionals in rural areas, in poor areas, in poor suburbs, and then you're going to have the money, and the money of those areas is going to flow to those professionals. So, figuring out how to spread healthcare equitably and get it across the world has been very challenging because, by definition, smart people live in rich areas and get attracted by money, and that's where you tend to concentrate facilities. So if you do this in the old world, you have to get there. And now you see in rural areas across the world, whether it's America, Russia, Canada, anywhere, unless you're in a very tightly compact European country, you're a long way away by driving your car from access to the best care. And if you have a complex condition, you may be hours by plane away from that. Mm-hmm. So the answer is, let's take the best of those systems, which is really what the Alis and the other folks in the world are trying to build AI is doing, taking the best of human knowledge, improving on it, and then distributing it equally. So this has, what I just said sounds easy, but it's incredibly complex politically, because there are huge, as I mentioned earlier, huge vested interests in every country who don't want to change the way they're doing things, and why would they? And then that requires political will to put that into place, and to take what's happening. Ali said civilization, went backwards. Take 2016 as the year where civilization went backwards, right? the idea that we're moving towards this lovely, homogenous, sort of nice, warm, gentle, liberal democracy where everyone's happy to spread the wealth and care equally is clearly not true. There are significant minorities in Western countries, maybe majorities in Western countries, who aren't that interested in sharing the wealth and their nice lifestyle with immigrants, minorities, people who don't look the same, who pray to a different God or what have you. And that's real. We have President Trump, Bolsonaro, Obama, a bunch of people that show that. So none of this is guaranteed. But I think the way you do it is you try to bring the system along with you, build the best technology, but bring the system along with you. So I think, there are a significant number of leaders of healthcare, whether they're physicians or others, who are interested in doing the right thing here and spreading the technology and spreading it equally. And even in the finance world, you get people like Google who've invested in Cityblock, which is a new type of clinic and healthcare provider aimed at the poorest people in America, in the inner cities. I think that there is a way we can do this. Is it going to happen inevitably? Is it all going to be motherhood apple pie and the best healthcare for everybody spread equally across the world? No, but we're more likely to get there with better technology, especially building off all the things that Ali mentioned, especially the communications revolution. 5G coming everywhere, and hopefully not too many people think that 5G on the post is going to brainwash your cat or whatever the fear of it is, but it's perhaps going to make broadband access easy for everyone, which fundamentally is another utility that we need to get over this disparity.